Here we go. Dr. Piskin.
Hello.
Hi, Dr. Piskin. Dr. Piskin, let's talk a little bit about sedation dentistry. Basically, kind of sleep, but not really sleep while you do dentistry. What is this all about? And I know you're doing it.
You know that there are a lot of people that just feel uncomfortable coming to the dental office, or they're comfortable while they're having work done. It's not the easiest thing, and you try to make people relax as best as you can. Today we can do things, at least in my office where I'm certified to do sedation dentistry. We're not doing we're not putting them to sleep like they do in the hospital, where they're having an IV or they're getting an intubation down their throat with an anesthesiologist. We're doing light conscious sedation. We're using some pills. We're using a little nitrous oxide. We monitor the patient. We make sure that their medical history is perfect for this. And everything we do is totally reversible. But it sure gives them a great sense of relaxation. And of course, there's a great part of it is that there's amnesic effect. They don't really remember. They go, he did a great job, but I don't remember much being there. And they walk in on their own, and they walk out with a little help with a friend or a family member. And it's just a great service.
So basically, it's for people who which there are a bunch of them out there, we all have it to a little degree, a little bit dental phobia. We just don't like to be there. But also, so that lasts a long time, right? I mean, so you can really do where you normally a patient would have to come in 4, 5, 6, 8 times maybe. You can do all that in one visit because the patient is not restless sitting in the chair and getting tired from opening the mouth or whatever it is. He just simply doesn't know what's going on, while yet he responds to you, right? If you ask him a question, he knows you're doing so, right?
That's correct. We want to always check that. We do make sure that they can respond. If they want to get up and go to the restroom, we'll walk them to the restroom. That's the state that they're in. And you can extend the visits to make them longer because they're not anxious, and you can do much more dentistry in that time and get to the end result much faster. And those kind of patients that are anxious and would like to have this kind of stuff love the fact that they get a lot more done, and they don't have to come back as many times for the visits. So we do set aside longer blocks of time, and they're comfortable, they have music, and they really don't remember a lot of the visit, which is amazing. So they don't listen to when I sing to them. They don't have to tell me they hate my voice. They don't even remember I sang to them sometimes.
Well, that's wonderful. Well, not just for patients who are, who are like anxious. I mean, yes, for them, but also patients who are not so anxious. But nobody, and take a business person, take anybody, job. Who wants to go to a dentist once a week for 6 weeks? If you can go maybe one time, knock a day off, and be done with it. So even if it's just a matter of speed. We're living in a speedy world, no doubt about it, and boom, you're done with all your work. I mean, even if you're not dental phobic, it must be liked by many people.
Well, it's easier for the dental staff to work on patients who are much more cooperative and easy to be with, that they don't have the anxiety. But just like you're saying, even the businessman who wants to get more things done and doesn't feel like he could sit for so long, it gives you the edge and them an edge to feel comfortable during a longer visit. So yes, you're right. Even someone who's not extremely apprehensive, but maybe a little, sure makes the visit much more pleasant for everybody. And it's not for everybody. There's certain medical conditions or complications with medications and medically compromised patients that we maybe can't do it on. We have to select and be very careful to make sure we do a proper medical history and sometimes get medical clearance, but the medications we use are very safe and they take a long time, and that's why it's called conscious sedation. And it's used with pills where we kind of grind it up and they just put it under their tongue, or they might take a pill the night before if they're a little anxious, and we give them all those things. and guide them during the whole time. And they're monitored with their blood pressure, their pulse, and other things. So it's relatively safe, and we've been doing it for quite a while.
Wonderful. Absolutely wonderful. Yeah, the anxious patients and the guy who wants to get more work done in one shot, whether he's anxious or not. Because I know when my dentist goes and does the regular cleaning and it drags out a little bit, you start there or sitting and counting sheeps, and it becomes, when is this finished? When is this finished? So imagine somebody doing 6, 7, 8 crowns, a couple root canals, and whatever it may be, and time flies.
You take a little snooze.
Take a little snooze. Wonderful. I love it. Thanks a lot, Dr. Piskin.